Sometimes I feel like the small intestine meridian is underutilized because in Chinese medicine, the small intestine organ system functions are pretty minimal compared to other organs' functions. But the channel, the meridian of the small intestine and its 19 acupuncture points are fantastic to use in clinical practice. And this is what we're going to talk about today. Welcome back to my channel. I'm Clara. If it's your first time here, I create acupuncture and Chinese medicine content for students and practitioners, making it easy to grasp and fun to learn. Let's do this. In this video, I'm going to look at the small intestine channel pathway and its function as a meridian. Then I'll look at each small intestine acupuncture point's location, function, and any clinical pearls to help you get a better outcome with your patients. I'll differentiate each point so we get a really good understanding how to use them in clinical practice. Let's go. Before we start looking at the pathway of the small intestine channel, I want to remind ourselves the function of the small intestine organ in Chinese medicine. It's all about separating the clear from the turbid, or separating the liquids, the clear liquids which will keep to nourish the body and the mind, and the turbid which basically will go down to the bladder and be excreted as urine. Now, the other one is the mental aspect of separating the clear from the turbid, meaning the ability for someone to differentiate between right and wrong. So that is also an aspect of the small intestine that sometimes I think is forgotten, because we will see some of those points are really useful when it comes to mental health. Okay, so let's start with the channel of the small intestine. The small intestine channel is a hand channel because it starts at the hand. It's also a Tai Yang channel because the two Tai Yang channels are the bladder, which is a foot meridian, and the small intestine, which is a hand meridian. Tai means greater, and Yang, obviously, opposite of Yin. Because it's greater, it means it's the most surface. So the bladder meridian and the small intestine meridian both are going to be the most surfaced one. That's why they're really useful when it comes to treating external pathogen invasion. The second thing is the small intestine channel is activated mostly between 1 and 3 p.m., right after the heart channel, right, which is at lunchtime. So the 1 to 3 p.m., which is the small intestine time, is when we want to drink more water, because in general, drinking water is really important, specifically in the afternoon. And this is when people get dehydrated the most, at small intestine and bladder time, which is 1 to 3 and 3 to 5. The small intestine channel starts where the heart ended, which was at the tip of the fifth finger. We start at the fifth finger, go all the way up to the scapula, we'll go to Du14, then we'll enter the body to connect to the heart and small intestine. One branch at the supraclavicular fossa will go up to the outer canthus and finish at the ear. And the second branch starts at the cheek, separates right there to meet the bladder meridian and bladder 1 at the inner canthus. The small intestine meridian's function as a whole is obviously anything that's happening along the pathway of the channel. So pain along the pathway, all meridians do that. Plus, it is going to be useful for anything happening in the ear, cheek, jaw, neck, specifically external pathogens like swollen lymph nodes, as well as mental health issues. Good? All right, let's start by looking at each point. Small intestine 1, as you can see, is at the base of the corner of the nail on the ulnar side, while heart 9 is on the radial side at the base of the corner of the nail. Small intestine 2 is distal to the fifth metacarpal bone, and small intestine 3 is proximal to the fifth metacarpal head. Small intestine 3 also, if you look at your hand, there's always a line here. When you make a fist, there's a line. This line is exactly where small intestine 3 finishes. So for me, if I go along the line, this is where small intestine 3 is. When we needle it perpendicular, straight in, through. So often it'll go through quite deep, and I've had that point done on me many times. It is pretty powerful because of where it's located, specifically if you need it. Now let's look at small intestine 4. Small intestine 4 is between the hamate bone and the fifth metacarpal, right on the ulnar side of your wrist, while small intestine 5 is on the other side between the tricuspid bone and the styloid process of the ulna, both on the wrist area. And then what's funny about small intestine meridian is small intestine 6 kind of diverge and is not along the ulnar side of the arm, but it's more in the back, in the posterior side, right on the radial side of the styloid process of the ulna. Often when I was in school, our teacher would show us that if you put your finger or your index finger on your styloid process and then you turn like this is where your finger ends. That's where, again, we start here and then we turn. And then that's where small intestine 6 finishes or is located. Small intestine 1 is a Jinhua point, which makes it perfect for fainting, fever, or manic behavior. However, it's also used for lack of breast milk, specifically combined with REN17 and large intestine 4 to get a better flow and better milk. Obviously, if the lack of breast milk is due to blood deficiency, we need to nourish blood as well with spleen 4, stomach 36, spleen 6, and obviously take formulas to enhance the blood nourishing purpose. Small intestine 2 is a yin spring point, which are often used to clear fire and heat. This is why this is a great point for blood in the urine. We still need to figure out why is there blood, but in the meantime, this is really good to help detoxify and clear the fire that's invading the bladder. And remember, the small intestine organ separates the clear from the turbid. So when there is blood in the urine, it could come not just from the bladder, but also from the small intestine TCM organ. Small intestine 3 is such a powerful point, specifically because it is the dew confluent point, which means it is going to be fantastic for any kind of back issues, from the neck all the way to the sacrum. Plus, it is fantastic for scapular knots. You know that knot that's in the back of the scapula that just is painful? This is really good as a distal point combined with the local points of 9, 10, and 11 of the small intestine. It's very powerful and it works really quickly. Small intestine is also used for night sweat, occipital headaches, sore throat because it can be used for external pathogen invasion, and earache or tinnitus, specifically tinnitus that is acute, not chronic. It's also the shu stream point of the small intestine, which makes it really good to be used for manic behavior with anxiety. And this is the connection to the heart meridian as well. Small intestine 4 is an acupuncture point I have barely used in clinical practice. It's not a point I gravitate towards, but it is the urine source point of the small intestine, which makes it a great point to use for any pain along the meridian, specifically neck, occipital, back of the shoulders, and elbow pain. But it can also be used as part of a protocol for jaundice. Small intestine 5 is another point I don't use often in clinical practice. However, it is the Jing River point, and so it's very well used for swollen lymph nodes, which can be combined with Li4, also with large intestine 6, and points along the lymph nodes area like small intestine 17. So local and distal always work really well. As you can see, a lot of the small intestine acupuncture points are really used for pain along the channel. Small intestine 6 is the Shi cleft point, which means it's one of the best points to use when there is pain along the channel. Occipital pain at the elbow, at the upper shoulder, or anything happening along the meridian. This is the best point because the Shi cleft point is always good when there is blood stasis and pain. Are you enjoying my graphics so far? Well, you can find them all in my AcuPoint Made Easy, an illustrated guide to all acupuncture points, and so much more. The PDF version has a lot of video links. You can download it on your phone, your tablet, your computer, and have it at your fingertips at any time. It has a great table of contents. The hard copy ships all over the world if you're someone that loves to hold a book and really enjoy the colorful part of my graphics. You'll find them all exactly the same as the PDF in the hard copy book. The feedback has been amazing. As you can see here, so many people have just loved the book or the PDF or both. So what are you waiting for? Click the link below and get your copy today. Let's get back to what we're talking about today. Small intestine 7 is located on the line between small intestine 5 at the wrist and small intestine 8 at the elbow. It is 5 soon above 5 on that line. Small intestine 8 is located between the olecranon and the medial epicondyle of the humerus. I think often small intestine 7 is underutilized. It is the lower connecting point that connects the small intestine to the heart. And this is why it's a great point for anxiety or feeling hysterical or manic or just hyper, too much energy, too much fire in the heart. This is a really good point to combine with heart point to calm the mind and also to clear heat, because this is really an excess with a lot of heat. Small intestine 8 is the Hussie point. Like all the points located at the elbow area or knee area, this is a Hussie point. Hussie points have the most chi and blood, so they're quite powerful. Small intestine 8 is great for local pain, elbow pain, but also all the way up to the upper neck and occipital area as well. Now, I know it's often used also for a protocol for epilepsy. Epilepsy is a difficult disorder to treat. This is just to try to prevent attack, not cure it. I just wanted to make sure we understand that as well. Now we're going to look at the location of the small intestine acupuncture points all on the upper back area. Starting with small intestine 9, which is located one soon directly above the posterior axillary fold. Small intestine 10 is directly above small intestine 9, just below the acromion. So you slide your fingers until you feel the acromion. Small intestine 11 is located on the scapula. And if you look at the scapula, it forms kind of like a little bit of a triangle. And small intestine 11 is located on the upper third of this triangle, from the lower tip to the upper part. It's on the upper third if you separate or divide it by 3. And it is right in the center. Small intestine 9, 10, and 11 form a triangle with equal sides. So that helps you. If you found 9 and 10, you can find 11 because this is a triangle that has equal 3 sides. All right, so now let's look at 12. Small intestine 12 is directly above small intestine 11 in the supraclavicular fossa. Then we have small intestine 13, which is located halfway between small intestine 10 and the lower spinous process of the second thoracic vertebrae, or T2. And then small intestine 14 is 3 soon lateral to the lower border of the spinous process of T1. And small intestine 15 is 2 soon lateral to the spinal process of C7. So that's a little bit of a zigzag there. Use a lot of practice to palpate all the vertebrae. It will help you tremendously. So keep practicing finding the vertebrae. I didn't want to separate the next 3 because really they are there to use for musculoskeletal issues. Small intestine 9, 10, and 11 often are combined together as a triangle, and they form a great powerhouse to try to treat any pain, specifically a lot of tension and pain in the back of the scapula and upper shoulder, which is very common nowadays because everybody's behind a computer or on their devices. It is the same for small intestine 12, 13, 14, 15. It's all going to be points that are used for pain, like frozen shoulder and neck pain and any shoulder pain or area. It is very local use only. Now let's look at the small intestine acupuncture points located on the neck and head. Small intestine 16 is located in the posterior border of the SEM, sternocleidomastoid, at the level of the laryngeal prominence. Small intestine 17 is right in front or anterior to the SEM at the level of the mandible, the jaw angle. Small intestine 18 is located directly below the outer canthus and at the level of the lower part of your nostrils, on the cheek or the zygomatic arch. And the last one is small intestine 19, which is located right on the tragus, which is a point that is next to gallbladder 2 and Sanjiao 21. Those 3 points are all located on the tragus. Small intestine 16 and 17 often can be used interchangeably. I will use small intestine 17 more often because it's easier to needle and less uncomfortable for patients than using small intestine 16, which is right on the posterior of your SEM. Those points are used for ear issue, jaw issue, swollen lymph nodes, we talked about this earlier, tinnitus, ear pain, and specifically small intestine 16 for voice loss or sore throat. Those are great points for external pathogen invasion, more acute issues than chronic. I love small intestine 18 in clinical practice. It is so good for lower sinuses pain, lower sinuses being congested, specifically combined with Li4. It really clears the pain of the sinuses. That is a fantastic point for that. You can use it for a swollen cheek. It can be also used, and I've used it many times, as a part of a protocol for Bell's palsy or post-stroke issues like hemiplegia. Fantastic point. Love small intestine 18. Small intestine 19 is located in the same area as Sanjiao 21 and gallbladder 2. And often in clinical practice, I will use them interchangeably. Now, it depends on your patient and when you think your patient will benefit from which meridian the most. Your intention behind your treatment is the most important thing. Now, small intestine 19, Sanjiao 21, and gallbladder 2 are all great for ear issue, tinnitus, ear pain, but also jaw issue, TMJ, trigeminal neuralgia, and any kind of jaw pain. Did you know I also have other meridians where the points function and location? Check them out. Now let's recap each of the small intestine acupuncture points and how to differentiate them really quickly to utilize them in clinical practice. SI1, best point for lack of breast milk. SI2, best point for blood in the urine. SI3, the deux confluent points, fantastic for any spine or longer spine musculoskeletal issue or scapular, upper back, upper neck issue. Small intestine 4, great to have as part of a protocol for jaundice. Small intestine 5 is usually used for swollen lymph node. Small intestine 6 is the cheek left point, so best for pain along the meridian. Small intestine 7 is the lower connecting point, great for manic behavior, anxiety, and excess feelings, a lot of hyperactivity in the mind because it connects to the heart. Small intestine 8 is a great point for elbow pain, but also can be part of a protocol for epilepsy. 9 all the way to 15, musculoskeletal local use mostly. 16 and 17 can be used for swollen lymph node, loss of voice, or ear issue. Small intestine 18, best point to use for lower sinuses, pain, or congestion. And small intestine 19, because of where it's located, great for ear pain, tinnitus, but jaw pain as well, and TMJ. Wow, I can't believe we went through this so fast. Make sure to watch this video as well to complement what we just went through. Have a fantastic day. There's so much more on my website. Keep rocking it using TCM and check out acupunctureacademy.com resource page.